Hi, I'm Rikke Jakobsen, the CEO of Cannabis Danmark, and you're now listening to Professionally Cannabis.
Where do they go, the smoke rings I blow each night? Oh, what do they do, those circles of blue and white?
Good morning and welcome to our dedicated listeners. You're joining us for another episode of Professionally Cannabis. I'm Oscar Houseman, and with me is my co-host Johnny Weiser.
Hey there, Oscar. Listeners, today is a special day because I've got Oscar a present. Here you go, brother.
We've been talking about this one for a while, ever since you went to Greece, so I'll open it up. And it is a t-shirt with something that I probably can't repeat on this show. Well, I suppose we're the producers, right? It says Oedipus, the original motherfucker.
Live reactions, Oscar. What are your thoughts?
Well, it's factually correct. I don't know of any earlier motherfuckers than Oedipus. And as someone who took 3 years at university painfully studying ancient Greek, this about sums it up.
Awesome. Really glad you liked it. Now, moving on to something else our listeners might like. This week's interview is with Rikke Jakobsen. She is CEO of Cannabis Denmark. Me and Oscar actually met her face-to-face out in Copenhagen a couple of months ago. She's a bit of a rock star, no?
Yes, she is. Cannabis Danmark's doing great things. And they're actually working on a policy paper when I caught up with her a couple weeks ago, which they're just going to release straight away into English because they know how much the rest of the world's been following Danish cannabis regulation. I've been saying for a while now that they're really interesting because they've got a patient-led perspective and they're also trying to build the right environment for companies to thrive. Admittedly, it's a 4-year test program, but we've got reason to think that will stick, right, Johnny?
100%, not only being a really progressive program as far as European cannabis goes, but it seems to be that in Denmark they have real political support on both sides of the fence. This is really important as well because only a few weeks ago they had an election in Denmark. There are likely to be ministerial changes, and knowing that there's support on both sides of the fence means that we can pretty much say that this program is going to see its way through to the end.
Excellent. Well, without further ado, let's hear from Rikke herself.
Oh, what do they do, those circles of blue and white?
I'm delighted to say that this week's interview is being recorded live in Copenhagen at a conference. Today we're speaking with Rikke Jakobsen, CEO of Cannabis Danmark. Now, Rikke is one of the pioneers in bringing cannabis to Denmark. They've got a really progressive program and one that could well provide the benchmark for many other European countries when rolling out their cannabis programs. Rikke, we're delighted to have you with us.
Thank you.
Now, one of the questions we like to ask all our guests on Professionally Cannabis is what led you to the plant? I feel this answer may be a little bit different coming from a policy perspective rather than our traditional business one, but still very interesting to hear nonetheless.
It really started in 2013 with my father, who had prostate cancer, and we have read about medical cannabis, and he said to me, Rikke, should we try this, and could it be safe for me? And I said, I don't know, let's try it. And I bought it actually in the UK on the illegal market, and later on another country. And the first batch worked very well from the UK, and the second one didn't work. And the first one, while the first one worked, he got his appetite back. He had the nausea from his chemotherapy, but when he got the second, it didn't work at all. And he died at last and suffered a great deal at the end because we didn't have the right cannabis. But that's why I went into this area, because I don't want patients to be criminalized and I want them to have a product that they can rely on. So I was one of them among others, to form an association called Medical Cannabis Denmark and start lobbying for this trial we have today. And later on, Medical Cannabis Denmark merged into today's Cannabis Denmark, where I'm the CEO.
So it was activism which turned into governmental work.
Yeah. Yeah, it was.
Is that the first time in the world that's happened? I don't know anywhere else.
Because I have 25 years of political background in organization, I knew that I just can't stand on the sideline and provide politicians with the history from the patients suffering and so on. You have to approach it another way too. You have to lobby, and you need also, because that was my goal, to have research in Denmark in medical cannabis. And because I want that, I also need cultivating in Denmark, because they have to develop the product to specific diseases. So I talked to our food and agricultural organization here in Denmark, which is huge, and told them about all this and what's happening around the world. And they could see, okay, there could be some business for us here, and also we could help the patients. So they helped me to lobby it through. And at the same time, we had an actress called Søs Elin, who is very popular in Denmark. And she formed this organization, Cannabis Danmark, and got me into it, and also with my good friend Marianne Højgaard, who has a pain illness which is very rare. And together we formed a new board for this organization, and the rest of this is history. We are in the middle of it right now, and provide information from all stakeholders, from plant to patients, and also collect information from abroad, and try to push this forward all the time.
We're hearing great things about the progressive program coming out of Denmark, but for folks that are less familiar with your organisation, Cannabis Danmark, would you be able to tell us a little more about the trial program that you guys are rolling out?
People don't realize it took some years, and the first proposal in our parliament was in 2015. And from there to last year, when we got this program, there have been some couple of years where the government, the authorities have to collect information from abroad and do our own kind of scheme here in Denmark. The best of all the countries, from Canada, from Netherlands, from Italy, and do our own scheme. And we keep on pressing. When will it happen? When will it happen? And really, I think what we got is pretty okay. If you look around in the world, you don't have the perfect anywhere. But what we could see at the start, from the start, we had prescription the first day, and doctors, okay, there was some resistance. In every country, there's a resistance from the healthcare community. And we have the Doctor Association put on, sent papers around where stood, we don't prescribe cannabis in our house. It was in the windows and the doors, so patient couldn't even get to communicate with the doctors. You have that in the UK, unfortunately, yeah. The first thing is to get to the doctor and talk about it. Perhaps the doctor don't want to prescribe it, but they have to say why they don't want to prescribe it. They owe it to the patients. That's the first step. And if they don't want to prescribe it, then tell them where they can, to a specialist or something else.
So that was actually something I wanted to touch upon. One of the issues in the UK is that, albeit medical cannabis has been legal since November, there's very, very low levels of education for clinicians in this specialist area, which has led to only a very small handful of NHS prescriptions being handed out and only a few more private prescriptions. With regard to the program that you're rolling out in Denmark, how are you guys ensuring patient access?
We don't have education yet, but we collect the side effects from the program. And the first year, our medical agency looked at the figures and said to us, yes, it's safe to prescribe. That's the first step for every doctor. This is safe to prescribe. My patient won't be harmed with the medical cannabis. The effect will come later. To measure the effect or to clinical research in effects must come later. That's my point of view, and also the authorities, also the politicians' point of view. This has to go hand in hand, because we're so behind. So when the doctors know that this is safe to prescribe, we can have the research in hand with the prescription.
So how did you get the evidence that it's safe to prescribe? Because in the UK, there's lots of controversy around things like psychosis, prefrontal cortex development.
We have a CPR system in Denmark where the doctors have to inform our medical agency if there's some side effects. Either the patient inform the doctors or the patient inform our medical agency itself. And that's how we collect the side effects. And there's no serious side effect. It's dizziness and dry mouth, as you probably heard about everywhere else. We have 1 or 2 serious side effects, but it's because of wrong dosing. The patient misunderstood the dosing.
Was the onus more, unfortunately, on the patient side, or was the incorrect dosage prescribed by the clinician?
The correct dose was prescribed, but the patient misunderstood it, apparently. Yeah, it happens, and it wasn't more serious that when it's THC, couple of hours, sleep, and you have a great time again. Yeah.
Since rollout of the trial, do you have any statistics about patient access that you might be able to give us?
Yeah, the latest figures comes from our Ministry of Health today, actually. Because I haven't seen the figures before. 2,000 patients right now, little over 2,000 patients, and was it a little about over 400 doctors, and mainly now it's GPs, which is surprising. Because before it was specialists, but now the GPs ahead of prescribing. Yes, and I think it's due to what tools do I have to neuropathic pain to my patient. Those tools I have now. It doesn't work. Now we're trying the new tool, medical cannabis, because it's safe to prescribe.
What would you say to political figures that might be listening to this? And what can other countries and other governments learn from the Danish experience?
It all comes down to working together, I think, between sectors, as we did, and have a communication all the time with the industry, with the patient organization, we are an independent interest organization, with the researchers. What they didn't do in Denmark was to get the advice from the medical community. And it took some time to get over. And that's why the resistance was so forceful. But I think they should reach out for those in the medical, the doctors and the physicians that are in favor for this, or not against it. Because that's what happened in Denmark. We had particularly one doctor specialized in pain medicine, Tina Horsted, and she was on board. And today, because we have so much research in medical cannabis, within a year we got, I think, about 14 or 15 studies where I think 4 or 5 is clinical standard with the high standard with the placebo and everything. Yeah, within 1 year. So we have this clinical cannabis formed by researchers in Denmark, and they are the spokesman is very progressive in this area and very keen to get on and on and on. Lucky enough, we have those people to drive it forward.
And where did these guys get their funding from?
This network, cannabis, clinical cannabis from, don't get funded anywhere. It's voluntarily, totally. And of course, the clinical research are getting funded, but not by so much by the industry. It's more like governmental or from their own university. Yeah. Or funding by the pharmaceutical funds. Novo Nordisk have a fund going into this. Lundbeck have a fund. They are now a little bit interested in the area and said to us, if there are some research or study we can support and you have a paper on it, then we will look at it.
We've talked about a lot of stakeholders here, but we haven't mentioned the cannabis industry, the Danish one in particular. I know there's 15 development license holders. How have they been interacting with you on this front?
Yeah, we interact great with the industry, and we have to. We have to, because we have to work together on this issue, because it's a so small pharma area still, so we have to cooperate. all through the value chain from the plant to the patients, because then we won't get further on. And I know they want to fund the research. No doubt about that. It's just how to have the right protocol, what kind of research, because we are not doing any research in the whole plant yet. We only do research in single molecule THC and CBD, or those two together. That's how far we are come if you want to have the high standard. And also I can see around, when you get to the phase 1, 2, 3, you have the single molecule, except for Israel and autism, and I think also in the States with the PTSD research. But they have in THC and brain tumor now. Very exciting, because we have this Spanish research team in 10 years, and not because lack of funding, they couldn't get further with it.
I think GW did one as well, testing cannabinoids with TMZ for glioblastoma and extending life expectancies from 500 days to something like 900 days.
But I'm looking forward to the phase 2 research doing in Australia with the THC and brain tumor, and it will be a major impact on the cancer industry, pharmaceutical industry, if we can prove that the cannabinoids will help decrease tumors.
One of the things I was really keen to ask about is a political landscape in Denmark. Is there cross-party support for the cannabis program? And if there happened to be an election called in Denmark, what impact would that have on the future of your trial program?
Yeah, the lucky thing in Denmark is there's support from all parties. So that's a lucky thing, especially from the two biggest, those in government now, and also the biggest party right now, Social Democrats. So even though there will be a change of government, and I don't know if there will be, but we will see, because we have an election around the corner. And it will continue, because everything is supportive, both in for the industry's sake and for the patient's side's sake. So nothing will happen. Only that we will, of course, see, because it's a trial period, so there will be some adjustment along the way. And when we are finished with the trial period, it will be a permanent program with the adjustment and all the learnings we had done in these 4 years. So I'm not afraid when this term is ending. We will see a lot of patients and a lot of doctors, and a program where we can educate physicians. We have some in pipeline too with the education. So, yeah.
Does the trial program look to continue as is? Because in cannabis, 4 years seems almost a lifetime for the industry.
Yeah.
So will a trial in 2 years' time be as good as or similar to now?
Yeah. We have already just in 1 year changed some of the laws, adjust them in particular in the cultivation. We got also the export bill and something else for sale. Yes, the bill for sale also. So there's a small adjustment along the way, and there will be some more, I think, next year.
And for cultivation, can you talk us through the process? Let's say I'm a farmer and I want to get up and running. What do I actually need to do to make that dream a reality? You
can start on your own. With your own company, foreign company, go into Denmark, but you don't really know about the Danish law, or you don't know the Danish approach. So those who are starting by themselves without a joint venture or investment in Danish companies, they have a Danish one guy or woman employed to take care of these things, and then either do you make a joint venture on investment in a greenhouse, for example. You need a lawyer, and of course you need to talk to the authorities, local authorities, who is very helpful regarding is in Odense or in Viborg or all the Danish small cities. They are very, very helpful, because of course it's investment in the city. So they like the help in any way, and depending where your company will be, there's a high standard of education among the employees. because also we have huge medical industry, Novo Nordisk, Lundbeck, and so forth. So we have high educated employees in this matter. So that's what we can help with all because we have all the network. So we can do a whole list of what to do step by step by step. Yeah.
For investors and financiers that might have a spare few dollars or kronas to put into the cannabis industry, what's your plug for Denmark?
We are a very liberal country. Even though our medical agency is very harsh in the standardization, our communication between sectors is very high. And we can talk to the politician. For instance, I can talk to our Minister of Health and call the police if we want any advice from them or the medical agency. Even though we are up north, our energy is not that expensive. It's pretty much low. And then it's you can quick get all paperwork done regarding land, regarding joint ventures and everything. What I hear, if we compare us to other countries, that even though we think our medical agency is so slow, comparing with other countries, they are not slow. They are so fast. So the unbureaucratic communication lines in Denmark are so good. Yeah. And the other thing, we talk. Even we have aeronautic and cannabis in forms of spectrum. They talk together. They are competitive, but here in Denmark, what we have to agree on, we agree on to help each other make the business. And that's what we see among all the producers here, because we have our sponsors that meet 5 times a year and talk together and how we could agree on what we should advise the Ministry of Health and other ministries what to do in this area, what we can agree on in terms of education of physicians and so on. They have to talk together, and it's working pretty well.
So related to that, are there any other European regions or, in fact, anywhere else in the world you would like to enact something of their regulation or their regime, their way of doing things? Or have you got everything you want?
No. I would like an institute like they have in Israel, the Cannabinoid Institute, Technion. I would like the similar thing in Denmark. I have heard David Miri, who is in charge of it, and he's so right. That's the way to approach research in cannabinoids and medical cannabis.
Their research is top notch.
Yeah.
They've done strain-specific research.
Yes, and that's the way to do it. It's exactly the way to do it.
Something related to that is the question around all the products now only talking about THC or CBD levels. What we're doing about the 140 other cannabinoids that could have potentially life-saving effects. How do we get them on the curriculum?
So it is the same. We have to go a step back. And it's also what I said in my session today. We have to go a step back and rethink. And it could become the thing to do after this 4-year trial or incorporate it in our 4-year trial to collect all the products from our scheme here in Denmark, from all the producers, and compare it to each patient and illnesses. Does this work? Does this work? Does this work? They can do it in Israel. Of course, we can do it in Denmark too. And we have, unfortunately, the surveillance of all patients and people. But it's good when it's collecting data for the medical purpose. So it's very easy to do it in Denmark. And hopefully we can get it, but it costs millions. So, and the industry can use it because it's ground research, and they can see, okay, this strain with this content, it works for this illness. Maybe I should try to do some phase trials in this because it's very promising to just this illness. So the industry can use it too.
And does Denmark have that variety of strains that would allow that?
Not yet, because right now we are importing cannabis, but within 2 years, 15 products with all those cultivators in Denmark. We will end up with 50 products in Denmark. I'm sure that they have to sell it in Denmark before they can export it. So we are a small country, so we will be flooded with cannabis.
And flooded with cannabis might make some people who are against cannabis, especially those who see medicinal cannabis as a gateway for recreational, as something to worry about. How do you see the future of recreational cannabis in Denmark, or Europe for that matter?
And we are only working with the medical side of it, but we can't avoid that in some time, in about 4, 5, 6 years, I don't know how many years, it will become, regard we want it or not, because the bricks will fall around in Europe, so it will come. I got one advice, actually from a rower in Canada. She said, because of the Canadian adult use now, she said, Rikke, you have to get the endocannabinoid, all the endocannabinoid learnings into the medical school before we get anything recreational in Europe or in Denmark. If you got it in school, then you're secure with the medical cannabis. So that's the way to go before. Yeah, it's a race against time, yeah.
You'll get the education minister on the podcast.
Yeah.
For listeners who aren't so versed in Rikke's work, so we're recording this podcast live from a cannabis convention in Copenhagen, and I think it would be fair to say you're somewhat of a rock star here.
Is it true?
I think so.
Is it true?
I think you're pretty clearly dressed like a rock star.
I'm turning 50 this year.
Yeah, but being a rock star is a state of mind. Look at Mick Jagger.
Okay.
Mick Jagger.
Okay.
And with regards to your illustrious career, once the cannabis program is fully up and running in Denmark, and once you think your work is done, what next for you personally? Do you see yourself taking some sort of pan-European advocacy position?
I'm already trying to. What I talked to several of the participants today, I say we have to talk with the EU on the difficult to trade across the borders. They don't have approached the medical cannabis issue. Not at all. Only the cannabis-based issue, and it's Sativex, EP08, and it's if they only want to throw money in cannabis-based medicine research for that, we can wait 10, 20 years before we help the patient. So already now, I'm trying to gather people or to see who want to participate with me, and try to reach out to the different members of the parliament in different countries to pressure, to get this pressure on them. It's a very important issue because just take the trade. It is so expensive, and even though we will be flooded with cannabis, all the VAT, all the fees, everything, it will be so expensive for the patient still. So but when everything is okay, also with the EU, my job is finished. Maybe it is. This is my case and this is my issue. I'm not the one who's going to sleep in some authority chief or something. That's too boring. So I'll take another issue. But it is also collect the people from different countries, so everybody is represented. And if it's researchers or physicians or somebody who has been in the industry for several years, the main point is that it still is a cooperation between industry, patient, and researchers, and not just patient and researchers. Because if you lock out the industry, you're lost already. Still, the area is so small, and the industry has many things to come with. They've been in this business in so many years, so know about medical cannabis.
Well, we've got time for one more question, so if you'd like to, I think it would be nice to end on a fun one.
Okay, fun one.
If you could make one left field prediction for European cannabis this year, something that you can really foresee happening that's going to shake things up, what's it going to be?
It's so hard to predict this area. I think some industry have already realized that if you want to get it to the pharmaceutical area, life science area, where I wanted to go to, you have to do certain things. I think there will be a realization in the whole industry, and there will be some buyouts, because right now it's not a mess, it's just a hype. And like we have seen in the ET industry and so on, buyouts.
Well, the buyout stories would be interesting to hear, but that's all we've got time for. Thank you for being such a wonderful guest.
Yeah, thank you too.
Where do they go, the smoke rings I blow each night? Oh, what do they do, those circles of blue and white?
Well, listeners, we hope you enjoyed that episode, and we'll for sure have more interviews with pioneers in European cannabis later in the series. But for now, please do like, share, subscribe, leave us a nice comment, and Oscar might get me a present. That's all for now.